Chronic obstructive pulmonary disease, COPD, is a progressive lung disease that causes difficulty in breathing due to obstruction of airflow. It encompasses conditions like chronic bronchitis and emphysema, which often occur together. COPD primarily affects the lungs and leads to long-term breathing problems, including shortness of breath, wheezing, coughing, and mucus production. Causes of COPD. Smoking. The leading cause of COPD, cigarette smoking accounts for the vast majority of cases. The harmful chemicals in smoke damage the airways and lung tissue, causing inflammation and narrowing of the air passages. Air pollution. Long-term exposure to pollutants, including chemicals and dust, particularly in occupational settings like construction or mining, can increase the risk of COPD genetic factors. A rare genetic disorder called alpha-1 antitrypsin deficiency can predispose individuals to COPD. This genetic mutation results in a lack of a protective enzyme, leading to lung damage. Respiratory infections. Frequent respiratory infections during childhood can contribute to the development of COPD later in life. Diagnostic tools for COPD. Spirometry. The most common test for diagnosing COPD. This test measures how much air a person can exhale and how quickly. A reduced airflow, indicated by a low forced expiratory volume in 1 second, FEV1, compared to forced vital capacity, FVC, helps confirm the diagnosis. Chest X-ray helps to rule out other diseases with similar symptoms and can show signs of lung damage or emphysema. CT scan. A more detailed imaging tool than X-rays, it can show the extent of lung damage and emphysema. Blood tests. Blood gases may be analyzed to check oxygen and carbon dioxide levels in the blood. It helps evaluate the severity of the disease. Pulse oximetry. A simple test to measure the oxygen saturation level in the blood. Treatment for COPD. Although there is no cure for COPD, treatments aim to manage symptoms, improve quality of life, and slow disease progression. Smoking cessation. The most important step in managing COPD. Quitting smoking helps prevent further lung damage. Medications. Bronchodilators. These medications help relax the muscles around the airways, making it easier to breathe. Inhaled steroids help reduce inflammation. In the lungs, improving airflow. Combination. Inhalers contain both bronchodilators and steroids to provide enhanced relief. Oxygen therapy. For individuals with low oxygen levels in their blood, using supplemental oxygen can improve oxygenation and reduce strain on the heart. Pulmonary rehabilitation. A program of exercise, education, and support designed to improve the physical and emotional well-being of people with COPD. Surgical options. In severe cases, lung volume reduction surgery or even lung transplantation may be considered for patients with advanced disease. Lifestyle changes, such as staying active, eating a balanced diet, and avoiding respiratory infections, are also important in managing COPD.